Good afternoon, and welcome to Congressman John Garamendi's Coronavirus Telephone Town Hall. My name is Eric Olson, and I will be moderating tonight's conversation. Thanks for taking the time to join us this afternoon. We hope you find this call informative. In a moment, I'll turn the phone over to Congressman Garamendi for some opening remarks. But first, I want to explain the format for this afternoon's call. If you would like to ask a question, just press *3 on your phone. You'll be connected with a staff member who will take your question and get you into the queue to speak directly with Congressman Garamendi. Joining Congressman Garamendi tonight are Dr. Liu, the Bi-County Health Officer for Yuba and Sutter Counties, Carrie Underwood of the Sacramento Office for the Small Business Administration, and Solano County Workforce Development Board President Heather Henry to answer your questions about the virus and public health response. We hope to get to as many of your questions as possible during this call, so we ask participants to limit their questions to one each. Due to the high volume of questions, we won't be able to get to all of them on the call over the next hour. However, you will have an opportunity to leave a message for Congressman Garamendi after the call is complete. Again, press *3 if you would like to ask a question. Additionally, if you would like to subscribe to Congressman Garamendi's newsletter to receive updates on the coronavirus, please press *6. That's *3 to ask a question, *6 to subscribe to the newsletter. You can also follow Congressman Garamendi on his website at garamendi.house.gov and on social media under the handle @RepGaramendi. Now, here's Congressman Garamendi.
Eric, thank you so very much. And for all of you that are on the phone, thank you for joining us. And hopefully this will be an opportunity for us to learn from you about the things that are going on in your community, as well as for you to learn from our three experts that we just introduced. I know this is an extremely difficult period of time for you. Certainly it is for my family, as well as every other, really around the world. There's a great deal of fear. There's a great deal of concern about our personal and community economic circumstances. And we have a very tough road. It's very, very difficult in so many ways. I know for my own family, 5 of my family members are in the front line in the healthcare sector, and they come home every day, as do many others in our district, concerned about bringing the virus back into their home. And so today, let's see if we can move forward with a lot of the questions that you have. But before we go there, very, very briefly, on the national stage, there have been 3 pieces of legislation that have passed. The first was to try to get things up and moving in the healthcare sector, vaccines, other kinds of immediate efforts to deal with the epidemic. The second piece was what we called For the Families. That piece of legislation was unemployment insurance, set up a mechanism for families to obtain food in various ways. And then we moved to the third piece, which was the $2 trillion piece that everybody's talking about now. And that is what we call the CARES Act. And it provided funding for businesses to keep their employees on their payroll. That's called the Paycheck Protection Program, and also a program for emergency disaster loans for small businesses. Those programs are now in place. There was a bit of a startup issue about how to organize it and get it going. Many of those issues have been resolved, and those programs will be much a part of the discussion today. We're now looking at an additional piece to the CARES Act. That legislation is being debated right now in Washington. I just left a 2.5-hour meeting on that in a previous phone conference. The fundamental question currently, as the big Paycheck Protection Program is do we do more for paycheck protection? The answer is yes. But at the same time, we know that there is a crisis in our healthcare system, the hospitals, the clinics. We know that firefighters, other kinds of frontline safety personnel, police, and others that are employed by the cities are in trouble. Cities are running out of money. Counties and many states also are. Fortunately, that doesn't appear to be the case for California. So we want to try to provide that necessary funding so that the communities, whether it's education, police, or fire, the other necessary healthcare systems can continue. My bet is that gets resolved over the weekend, and next Monday, bill will pass Congress and be signed, and we'll move on beyond that. How do we open up the economy? A month and a half ago, the answer was said very clearly. It's 3 words. It's testing, testing, testing. Without a clear and robust and universal testing program underway, people are not going to go back to work. They won't want to sit next to somebody that they think may have the virus. They won't want to invite into their coffee shop or their restaurant or sit down in such a place unless they have some confidence that people there are virus free. That requires testing. Unfortunately, this is the great tragedy of the current, among the many tragedies. This one simply remains unresolved to this day. And so we need to push that along. You'll hear about the Defense Production Act, something that one of my colleagues and I introduced legislation on this way last September. Anyway, these are things that are out there. We can talk about those if you have questions about the legislative process. In the meantime, we have some terrific folks who are able to help us out. And one of the things we're all going to learn here is we're going to mute the button or hit the mute button when we're not talking. So let me turn to the questions that are out there. I think Dr. Lou can be our expert on healthcare systems. She's got a terrific background in medicine as a family practice doctor out of the University of Washington, and then Johns Hopkins, and also George Washington University. Carrie Ellingwood is a specialist at the SBA, the Small Business Administration Office. She was on a previous town hall we had last week, and she is just excellent. Heather Henry, also with us last week with the Workforce Development Board, both of them on unemployment insurance, on small businesses and the programs. So let's hear the questions that you have. Eric, let us begin.
Our first question is from Eric in Marysville. The question is, the Small Business Administration has said that funds for the Payroll Protection Program, the small business program, have been exhausted. Will Congress be approving more funds, and what does the timeline look like on that?
I think I'll take that one, Carrie, and you can add in on the processing piece of it, which I think is really an important piece. As I described just a moment ago, this is the issue that is currently being debated in Washington. The President and McConnell wanted to put $250 billion for the Paycheck Protection Program as it was written in the first legislation, which had some money for small businesses, but no money for independent contractors, and rather limited to in its scope for the small businesses. On our side, we wanted to broaden the scope for small businesses, broaden the amount of money for small businesses, and importantly, provide critical support for police, fire, education, and the healthcare system itself. That is being debated right now. For the life of me, I don't know why we're debating it. We ought to just do both and get on with it. When will it be done? I think it'll be done by Monday, perhaps over the week. The legislation voted on Monday, probably with a universal vote, and then it goes to the president. So I would suspect early next week, possibly even tomorrow. But next Monday's my best bet. Gary, can you talk about how you're taking applications before this money issue, and then where you are now?
Yes, thank you, Congressman. So as in our news release, we have stopped taking new loan applications because when there are no funds appropriated and we cannot take applications. In the Paycheck Protection Program, which is offered through our lending partners, if you have a loan application in process, the lenders have and the lenders have received an SBA loan number, those funds are part of the funds that are already allocated and set aside for you, and they can continue with those applications. In addition to the Paycheck Protection Program, the direct loan program from SBA, which is referred to as the EIDL, Economic Injury Disaster Loan, those applications are no longer being accepted, but if you have an application number from the SBA directly on the EIDL loan and you have a question as to the status of that, you can call 1-800-659-2955. Thank you.
Carrie, thank you. I'm going to, Eric, before you go to the next question, I want to add a little bit about the context of the current debate in Washington. Of the money that has currently gone out in the Paycheck Protection Program, $115 billion has gone to 5% of the applicants who have received over $1 million. Those who have received 150,000 or less, that's applications, and they've received 37 billion. Those two numbers indicate why we are saying, wait a minute, we really need to focus on the smaller businesses. As you might expect, the big companies got in first. 5% of the total applications with 115 billion, 70% of the applications, 150,000 or less dollars, 37 billion. Now, Eric, let's take the next question.
Thank you, sir. The next question is from Anita from Rio Vista. Anita, you are on with Congressman Garamendi.
Shall I talk now?
Yes, ma'am.
Yes.
Oh, okay. I'm just going to say I'm a senior and I live in a senior residence, and I paid on PayPal for 2 different types of masks. I haven't received a thing at all. So I was just wondering, where can I purchase masks so I won't get fraud? Because I need some masks because I am a senior, and I am staying in the house like I'm supposed to, but I kind of made a mask, so.
Anita, that I'm not sure that our panel has an answer to where you can buy a mask without getting ripped off. I think everybody on this call needs, let me just finish this and then jump in. Everybody on the call needs to be aware that there are plenty of fraudsters out there. So be careful as you purchase things, as you get involved. Yes, somebody seemed to have an answer here.
Yes, I know in Solano County, we have 3 different vendors that we work with that are making cloth masks. 2 of them are military spouses at Travis Air Force Base, so that is something that we can help with. And the idea is that we'll be posting some of those businesses that we're working with that are doing that through our social media and our website soon.
This may be an opportunity for you to explain how to get to your website so that they can get to the mask makers.
Yes, that would be helpful, wouldn't it? Our website is solanoemployment.org, and then our Facebook is Solano Workforce Development Board.
Perfect. Those will be on my website also, and you can get it there. I assume you could live in Yolo or Sutter or Yuba counties or other counties and still purchase masks?
Oh, absolutely.
Of course.
Yes.
Very good. Let's move on to the next question.
Great. The next question is from Doug from Fairfield. Douglas, you're on with Congressman Garamendi.
Hi, Congressman. Thank you very much for taking my call and hosting these meetings. I'm a business owner. I opened a store recently in Solano Town Center Mall, exactly a year ago this month. We've been closed down since the order came through on the 18th. And I immediately filed for a business interruption insurance claim. And I know other colleagues of yours have put forth legislation to make these insurance companies pay for business interruption insurance at this time. I was curious what you think of the matter and what you're doing to help those of us out that are just fledgling businesses.
I used to, when I was insurance commissioner a decade ago, wake up in the morning and be in a fight with an insurance company by the time I had my first cup of coffee. I believe that most business interruption insurance covers government shutdowns, mostly local government shutdowns. Maybe it's a business interruption caused by a fire department shutting down the neighborhood for some reason. This is a big question across the nation. Two things you should do. One, you should phone the California Department of Insurance. And I can still remember the helpline. It's 1-800-927-HELP. And register your concerns of insurance. I am confident that the current insurance commissioner is both aware and supportive of the effort for business interruption insurance to be a paid claim. At the federal level, I'm working with several of my colleagues on legislation that would define the current situation, both going forward and back in time, as not an act of God. And that in many of the insurance policies across the nation is an exclusion, act of God. So we shall see what comes of that. I would expect the insurance industry to do what it does best, which is to pay as little as late as possible. So it's going to be a big fight. In any case, that's basically where it is. That's my advice to you with regard to that and the current legislative issues. You might check at the state level, which I have not done, about any state legislation on this matter. Okay, I don't know if any of our participants have additional information on that, but that's, I think, where I understand the situation to be. Okay, let's take another question.
Our next question comes from Sarah from Yuba City. Sarah, you are live with Congressman Garamendi.
Hi, Congressman. I was calling and I wanted to ask about for the businesses that aren't able to get help. Like I own an entertainment center, so we're 100% based on people gathering together in large groups, and I don't know when we're going to be able to open back up. For those businesses that may end up having to close permanently and look at the options of bankruptcy, is there anything being discussed for help for them?
Before you get to bankruptcy, let's talk about what you do in the current programs once those programs are funded. Probably next week it'll start up again. Let's see, which one of my experts would like to take this question? Carrie, you want to take it from the SBA, and then Heather, some of the work you're doing in Solano County with the small businesses?
Yes, thank you, Congressman. We currently have available in your area our resource partners in the small business development centers, and they have business consultants there that can assist you in reviewing your current financials, looking at options when funding becomes available again through the hard work of our Congress to bring into effect our EIDL loans and the Paycheck Protection Program loans. I would encourage you to keep your ears open for news on when that funding comes through and jump onto the SBA.gov website and stay tuned to that information. Once that funding has been appropriated, we will be able to again start taking applications for the disaster assistance loans. In addition to that, in the Yuba County area, Sutter, Colusa, and Yolo, Placer, and El Dorado, we have our Capital Region Small Business Development Center, and they are there to help you at no cost. This is your prepaid tax dollars at work. They can sit down with you and assist you. I'm going to just give you their 800 number real quickly. It's 1-833-ASK, and then 7232, which stands for S as in Sam, B as in boy, D as in dog, C as in cat. for the CARES Act, there were additional funds allowed to our support agencies that we work with for $240 million to have these consultants available for you at no cost through our small business development centers and women's business centers. They're located all across the state of California. And if you go to sba.gov, local resources tab, you'll be able to put in your zip code and find the consultants that are closest to you. Thank you.
Very good. Heather, do you want to add anything from the work that you're doing in Solano County with your Workforce Development Board?
Yes, absolutely. So there are two pieces that I would respond to on that. In Yuba City, so that is our partner at North Central Counties Consortium. That's the workforce board there, and that would be a good group to connect to for Yuba City area. For Solano County, we are looking at or doing two different pieces to it. One, we did establish a layoff aversion fund for our small businesses in Solano County to be able to come up with creative ways to avert layoffs. So that would be funding equipment so that people can work remotely, or increasing sanitation and safety measures on site so that people don't have to be laid off. We have some breweries that we're working with, for example, that are moving to online sales, helping our restaurants to kind of make that switch to delivery. So that's one thing that we can do in Solano County. We did get an overwhelming response and in our first round of applications, and we've been seeing a lot of our partners and cities stepping up to help support that fund so that we can continue doing that. The other thing that I would say too is that if a small business is a sole proprietor, that's just an individual, then our federally funded Workforce Innovation and Opportunity Act programs that are both in Solano and in any of the workforce areas can provide some support for the individual to help sustain them during this time frame. So those would be two different avenues that I would suggest. And you can find more information about our Layoff Aversion Fund on our website, solanoemployment.org.
Heather, terrific. Can you give us the name of the organization in Yuba City
and
Yuba County?
Yep, it's NCCC, which stands for North Central County Consortium.
And they're available, they have their own website, and information is available there.
Correct.
So I want to go back to what Carrie was talking about with the help organization that SBA runs. Carrie, could you give us some indication of the kinds of information that that businesses would bring as they sat down or on the telephone now to go through how they would apply?
They actually, if they want to apply for assistance in terms of their financials currently, they would want that information. They would want to have last year's tax returns available so that they would be prepared with the information that's going to be in the applications. The small business development staff are very, very well versed in assisting small businesses with different finance options. They can assist you in repairing your credit if that is a challenge for you at this point. If you're looking for assistance in determining what are my next steps, I don't think I'm going to reopen, they can assist you in making those decisions, as well as making sure that as you go through the process of closing your business, you cover each area that you need to make sure you close in terms of your payroll taxes, your sales taxes, if those are applicable. All those things, these consultants at no cost can walk you through those decisions and give you assistance in those areas. Thank you.
And they would go to the Small Business SBA website to get the contact and how to get started.
Yes, they can go to
sba.gov. Perfect. Sorry to interrupt you, Carrie. Good.
Our next question is from Catherine from Marysville. Catherine, you are live.
Oh, thank you. Thank you, Congressman, and your panel for doing this town hall for us. And my question, well, I have lots of questions, but I can only ask one. So I think it's very important. It's about nursing homes, convalescent hospitals, actually across the nation, but for our Yuba Sutter area. It's very concerning to see the reports across the country about all of the people who have been dying and the COVID-19 just racing through these facilities. And I'm wondering what kind of oversight is there for our area? I don't know federally and on the state level exactly what the requirements are for oversight, for the hospitals or for the convalescent hospitals. And so that's my question.
Congressman, would you like me to take this one? This is Dr. Liu.
Oh, yes, Dr. Liu.
Thank you, Dr. Liu. I was digging back in my memory bank about my days at the state. So.
Yeah, thank you.
So thank you for your questions. I am also very worried about our skilled nursing facility, assisted living facility, group homes. We actually have a really dedicated group, and as recently as 2 days ago, I reconvened them. So I initially convened them about a month ago to check in how they're doing, and then when all of this sort of regional outbreaks have been occurring in areas and more populated areas of our state, I convened a call again with them. They're in actually a fairly good place, and I'm going to continue to touch base with them on a weekly basis. Some of the things that these care facilities have already implemented, and I'm very proud of them for doing that, is robust symptom screening of their residents and their staff, stopping all visitors so that there's limitation of people who are entering these facilities, making sure that they wear the appropriate PPE, especially masks, and practicing good hand hygiene. For any newly transferred in resident to their care facility, whether it be a long-term care facility or even a group home, they are actively monitoring those individuals to make sure that those individuals don't become symptomatic, say, day number 3, day number 4, after they are transferred into there. And then we have an open line of communication with them, so they have 24/7 access to us in public health through a secured phone number. So if there's any questions, they know who to be able to reach immediately, and there's not a delay there.
Thank you very much, Dr. Liu. At the state level, there is an organization at the state level that is responsible for the licensing and the monitoring of nursing homes. I'm wrestling with the name of that organization, but it does exist, and they do periodic inspections. I would expect, given the experience in nursing homes around the nation, that those inspections are occurring more often. The rest of the story is the kind of work that Dr. Liu just described. There's one more piece of this puzzle, and that's the testing. Dr. Liu used the word symptomatic. And Doctor, you may want to just spend a moment talking about asymptomatic and symptomatic and the risks associated given the nature of this virus.
Sure. So more and more literature has shown us that people can be infectious even though they do not exhibit symptoms. So we list them as asymptomatic, without symptoms, or even potentially pre-symptomatic. Most of the time, these situations occur about 2 or 3 days before symptoms would arise, if at all. So that's the good thing and the impetus behind one, sort of a universal facial covering when you go outside in the public, and then 2, for these long-term care facilities and other congregate settings to institute universal facial covering and, if possible, surgical masks, especially for the healthcare personnel.
Thank you very much, Doctor. Let's take another question.
Our next question comes from Arena from Davis. Arena, you are with Congressman Garamendi.
Okay, thank you. Thank you for taking my question. So with respect to adequate and most importantly, safe personal protective equipment, which is PPE, I represent a group of medical spouses who are gravely concerned for our partners, of course, ourselves, and our children, since by association, we're automatically considered high risk. Therefore, not having adequate and safe PPE puts not only our partners at risk, but also our families and our loved ones and our children. So my question is, when is there going to be adequate supply of PPE? And before answering this question, please note that decontamination devices to clean N95 masks is inadequate since these masks are not designed for multi-day use. They must fit properly in order to be effective. So if the elastic or fitting wears out over a course of 2, 3, or even 7 days, these masks are essentially become ineffective. That's my question. Thank you.
I'll try to answer that. That, in fact, was the subject matter of another of the conference calls I was on with the House Armed Services Committee, of which I'm the chairman of the Readiness Subcommittee. All of the military's ability to conduct its programs. And the personal protection equipment issue is central to, I think, one of the great failures of the current administration. That failure is the failure to use the full power of the government to organize and structure a response to the challenge that we all face. Certainly the challenge of testing, which is still unresolved. The challenge of personal protection equipment, and now the question of how do we reopen the economy. All of those really require a strong central government approach. And the administration chose not to go that way, but rather to rely upon the supply and demand, the normal or the abnormal market with hospitals, nursing homes, fire departments, police departments, others, all trying to do the best they can to secure the material. Unfortunately, very little of that is made in America. A lot of it is, almost all of it's imported, much of it from China. China has its own set of problems. So here's where we are today. After 2 months of banging away on the Department of Defense and the administration, late last week, the first contract using the Defense Production Act was signed. And that is a contract for N95 masks. Earlier today, they said a second contract has been let for N95 masks. Obviously, they're much more than just masks. Other kinds of protective equipment is necessary. That's a month and a half of wasted and very, very dangerous time. It appears as though there's somewhat more willingness to use the Defense Production Act. I'm going to add one more thing. About 95% of all the generic drugs available in America are produced in China, either the drug itself or the ingredients of the drug. We are at total risk here. My colleague on the Republican side, Vicki Haltzer, and I introduced a bill in September to require the Defense Department to use the Defense Production Act to cause those drugs to be made in America. That may yet become law. So here's where you are right now. The state of California is contracting to get masks. Your point, the question you raised about a spouse coming home. My daughter is a family practice physician. Her husband's an emergency room physician. Another daughter is a nurse, and another daughter is public health official, all of them on the front line. I know exactly what you're talking about, the fear of coming home. So at the moment, individual organizations are left to their own devices, and that includes the state, the county, the hospital, and the like. Very little from the federal government on this line, and it's, in my view, one of the great failures. Dr. Liu, you're on this also. You want to add anything?
No, sir. I think you kind of hit it in the nail on the head that supply chain is severely lacking, and it is quite unfortunate and pretty frustrating, but we're trying the best that we can whenever healthcare facilities request up to us. It's the county level. We quickly elevate it if we can't supply it to the region level, and then, of course, then onto the state and the federal level.
Okay, let's move on. We'll take another.
Great. Our next question is from Tanya from Dixon. Tanya, you're on with Congressman Garamendi.
Thank you so much for holding this town meeting. My name is Tanya Everhart. I'm also the Chief Administrator with the Dixon Chamber of Commerce. I have had a business contact me very concerned about not being able to pay their property taxes due to the COVID-19. They've lost over $40,000 in revenue over the last month, and I was just wondering, is there any help for them? In speaking with the county, or not speaking, but learning some of the information that I've received, there really isn't anything. So where can I direct them to help them get some relief? They don't want to write it off completely. They just want a deferral until they can get back on their feet.
I am not familiar with where Solano County is on this one. Heather, you may have some information on it. I do know that federal taxes are deferred until July 1st, and possibly will go beyond that. But that's not a property tax issue. Heather, do you have some sense of where the county of Solano is going on this one?
I know the county is taking some leadership from the state on that piece of it, and the state's still trying to decide if there's going to be anything for property taxes. So there hasn't been any decision made at the county level yet.
I'm going to come back in on this one with the two things. First of all, the current debate in Congress about the new funding for the CARES Act is precisely this issue. The county property taxes were due yesterday, and we have a situation where the counties are going to have a lot of taxes that are not paid. And we do know that many of the smaller counties are going to be very soon. And that takes us back to the support that we want the federal government to provide for counties and cities and hospitals and the like, and special districts. There may be some information that there is an SBA issue here. Heather, this is a small business. When the program gets refunded, what should this lady do? What should this business do, and how can the chamber help them?
So, and we do still have some funding, and we do have some that is going to be coming in over the next week. So I would still encourage anyone interested to apply for the layoff aversion fund. But what it can do is to help kind of alleviate some of the other costs in creative ways. So we can't fund payroll or things like rent and utilities, but we can work with businesses to be creative in funding other pieces that are going to help avert layoffs, and then be able to leverage that funding in order to be able to keep their funds to be able to pay things like property taxes. So we can be very creative with businesses as long as the funding that we're infusing into a business helps save a job. And that's really the bottom line for our layoff aversion fund. And we're willing to work with businesses to get creative in how to make that happen.
Thank you very much.
So there is a There's an application on our website. It's just a 2-page application, and then that can be sent via email, and all of those instructions are on the website, and our turnaround time is about 1 week.
Very good. You're not taking out. Are you taking applications for this special program, or is this the PPP
Yes.
program?
No, this is for our Layoff
Special
Aversion Fund program. Yes, our special Solano County program.
I got it. I thought I was talking to Carrie. We were actually talking to Heather.
Oh, you said Heather.
Good.
My apologies.
No, not yours. My mistake. Let's take another question.
Great. Our next question, just before we go live, just a reminder that to ask a question, press *3, and to subscribe to the newsletter, press *6. Our next question comes from David from Live Oak. David, you are on.
Hello, Congressman. My name is David from Live Oak. The question is concerning the stimulus checks we got from the IRS into our accounts this weekend. Are those deferred? Do we have to pay those back?
They're not deferred. That's your money. You don't have to pay it. It is not income taxable. So no, that is not a loan. That is to keep you in bread and hopefully rent for some time, not a very long time, but that's yours. So don't worry about paying it back. You're not going to have to do that. And you're not going to pay income taxes on it either. Good question. I'm glad you received your direct deposit. For those who have not filed their income tax with a direct deposit, you can go to the U.S. Treasury website. They have a portal there where you can enter information about your bank, and you could receive your support check, your support payment in a direct deposit and not wait for the paper check with Trump's signature on it to arrive sometime in the future. So anyway, that portal is available through the Treasury Department website. And I would encourage you to do that. It'll probably be a matter of a month, maybe even longer, that money would come to you sooner than later. Next question.
Our next question comes from Jaswat from Yuba City. Jaswat, you are on with Congressman Garamendi.
Hey, Congressman, thank you. Sincerely appreciate you taking my call. Sir, my question is, I have a small business, and my lease is supposed to expire end of this year. I've been trying to talk to my landlord. It's a national organization, Danaher Schreiber. Trying to speak with him, say, with the current dynamic, my restaurant's closed, to give us some rent relief. And rather than giving rent relief, and they want me to sign another lease with them, they said, we'll give you rent relief unless you sign a longer lease. I feel that's pretty unethical. Is there any laws in place or anything our government's doing to prevent some of the landlords who are taking advantage of small businesses during this time?
Let's Carrie and Heather, why don't you chime in on this one? From what is some cities, some counties have passed ordinances dealing with this issue. So let's see. How about Solano County and Heather, if you know beyond that, and then Carrie, whatever you may have heard in your experience.
Okay.
Solano County hasn't issued a specific one. They have been utilizing and following the state's orders, the state executive order. So that is what Solano County is following as far as the rent moratorium.
Okay.
Thank you, Heather.
That specific information. Go ahead, Carrie.
I was just going to suggest we do have resources in the Yuba City area that can assist you in approaching individuals such as your county offer and see what they're doing. I know Sacramento County has put out and Sacramento City have put out a request for allowing people to have that relief from those rent payments. So if you were to go to the SBA.gov website under local resources, You can put your zip code in there, and you can find the Small Business Development Center that is near you. I believe we have someone who works out of the Yuba City Chamber of Commerce office, and they can assist you at no cost to help you work through that challenge. The other thing you might also do as you keep your ears open on the news, when the funding is appropriated by Congress, SBA will be able to open up our economic injury disaster loan portal, and you would be able to apply in there at that time. Currently it's closed, but when those funds are allocated, we will be able to assist small businesses again. And any of the small businesses that apply directly at the SBA.gov website will be able to use those for any of your regular business expenses, taxes, whatever it is that you need to keep running your business, that would be available to you. Thank you.
Congressman, may I add one more piece?
Please do.
Legal Services of Northern California has also been doing a lot around rental rights, and maybe a really good resource to identify what rental rights and pieces are in place in each of the Northern California counties.
Thank you. Very good information. At the federal level, at the present time, there is no law that would abate rent payments. I know the state is considering it, and some cities and counties have already done so. I think San Francisco among them, and Oakland. With regard to, there are laws on the books, and I'm confident they're going to be strictly enforced, having to do with profiteering, price gouging, and things of that sort. So with regard to your own situation where you seem to be in a negotiation, you've got the advice from Gary and Heather, and you might also contact the state rep up there, the Senator Nielsen, and your assembly member. And they may be able to provide information on what the state laws are and what is being considered at the state level. That's Gallagher and Senator Nielsen. Okay, next question.
Our next question comes from Marilyn in Fairfield. Marilyn, you are on.
Good afternoon. I'm so glad that you're having this town meeting at this time, especially with everyone's concerns. And I appreciate all the information for the very current interests, but I'm also looking at the long-time picture of all of this. I was wondering if Congress has received any kind of updated reports on the status of developing a vaccine for this virus.
I will chime in on that, but I'd like Dr. Liu to give a little more information on the how a vaccine is developed and some of the issues surrounding the vaccine. Doctor, if you'll take it at that level, take it as high and as broad as you want, and then I'll come in with where I believe we are at the federal level.
Yes, sir. So in order to take a vaccine, first we have to identify the virus, right? So that has been done, and we have the full DNA. But now what we need to do is we actually need to enter into phase 1, which is testing and making sure it's viable in the lab. And then the next phase would be testing in animal studies. And then after that would be in human volunteers. And it's not just anyone can qualify. There's stringent criteria based on institutional review board guidances because we want to do it thoroughly and ethically and safely. And then after that, when the vaccine has passed through those several steps, then they actually have to be implemented in an area that is hardest hit, for example, and then trying to do a vaccination among a group of people, and then watching them and monitoring them for side effects, for adverse effects. And there's a difference between that because side effects can occur right away, but then adverse effects sometimes take a long time, days to weeks. weeks to manifest, and then after that, that's when the vaccine would be ready to roll out. Hence why the timeline that has always been given out by CDC and other experts federally is a year or even 2 years. It's because of this rigorous process. Historically, in the world, we have rolled out vaccine a bit too rush, and it has caused a lot of safety issues.
I believe that happened with swine flu in the 70s, 80s. A vaccine came out, and it turned out to be a real serious problem for many people. Nationally, in the first legislation that was passed in early March, we provided $2 billion to support federal and state efforts to develop vaccines. Some of that funding is now at the University of California, Davis, where they are using the extraordinary research capabilities at that campus and at the medical facility, both on campus and in Sacramento. So they're working on a vaccine in a partnership with other universities around the nation. I understand that China is moving very quickly to develop a vaccine and has several studies, perhaps human studies underway. Other countries also. Here's one of the problems that I think exists, and that is at the moment, the United States is not engaged with other countries in a unified effort to develop a vaccine. It looks to me as though many countries are competing to be the first and not necessarily the most cooperative. I think that's a problem. Hopefully it won't present a problem for America. It does take the ability of vaccine. I'm quite certain that if China develops a vaccine sooner than the United States, they will use it in their country first. And we might very well do the same if we were the first to develop a vaccine. And so that's why international coordination, cooperation on this, in my view, is extremely important. We're all in this together, and that means really the entire world here. In any case, there's a lot of money out there. There was more money in the CARES Act, and the second and third round, there'll be more money to push this all along. Next question.
Our next question comes from Laura in Vacaville. Laura, you're on with Congressman Garamendi.
Yes, thank you. I was almost going to call you Governor. Thank you, Congressman Garamendi and panel. I'm sorry. I understand in the future Governor Newsom wants to test all before returning to work. Okay? He said test, test, test 3 times. In view of this, how will this roll out for school children returning to school? In addition, students will be separated in smaller groups, class size reduction, amongst a lot of other measures. So how will California address this subsequent and apparent need for added teachers? Thank you.
I'm going to jump into this one first, and then Dr. Liu, and if you would come in with your expertise on it. In 1966, my wife Patty and I participated in an international effort to wipe out smallpox. And we were in the boondocks of Ethiopia, and WHO arrived with smallpox vaccination kits, and together with others, we developed a cadre of people to go out into the villages, and we're talking real remote, no electricity, no running water, none of that, and carried out a vaccination program. Some of us remember the vaccination program for polio. We lined up in our, 6th, 7th, 8th grade class and rolled up our sleeves and got the polio vaccine in the school at that time. Bottom line is there was an international and a national effort put together to roll out enough vaccine and enough people to do the job. I will be introducing legislation maybe tomorrow or Monday next week, to use the AmeriCorps as a foundation for the employment of anywhere between 500,000 and 100,000 Americans, young and old, to become part of a health corps. And that is to dovetail with what Governor Newsom has already put in place in California, which he calls the California Health Corps. We're going to need hundreds of thousands of people across the nation to carry out a vaccine and a testing program. And along with the testing, you need the follow-up. Enough from me. Dr. Liu, you want to add?
I'm actually really excited about that legislation, and I totally agree that as we consider opening back up in a methodical manner, we really need to think about doing business differently, whether it be our schooling, our private businesses, or even governmental function. The serology test to test for immunity, there's a lot of still ambiguity about, one, how long an immunity actually truly lasts for this virus. We've only had the virus in the human race for 4 months, almost 5 months now. So we don't know if the immunity, once shown in the antibody test, will actually last, indefinitely or even for a year, sort of the assumptions we have for the seasonal flu vaccine. So that's one thing. And then even if the immunity is there, the readily available tests, serology tests, likely won't happen for several months. Currently, FDA has approved only 3 companies to perform serology testing, and it has not been given out in terms of testing supplies throughout the state of California just yet. We're looking forward to it, but that hasn't happened as of right now.
Dr. Liu, thank you. The information on the Health Corps, the national program that we will be introducing, will be on our website, garamendi.house.gov, probably tomorrow or Monday, depending on whether we can get it tomorrow or the next day. Good. Next question.
This will need to be the final question for the evening. It is from Ben Flores from Yuba City. Ben, you're on with Congressman Garamendi.
Hi, Congressman. Thank you for this opportunity. I run a healthcare organization based in Yuba City, and we also have issues with the lack of adequate PPE and supplies and testing kits, etc. But at this point, my question is more regarding to loans that are available now for the small business. We are a company of just over 500 employees, which makes us not eligible for small business loans. Are there any loans that would be also forgiven if we keep all the staff that we have in place for agencies like us? We're fighting really hard to maintain all of our employees in place despite the substantial loss in revenues due to this stay-at-home. So what can you tell me about that?
I want Carrie to take this one up, but before you do, are you a health clinic qualified federally?
Yes.
Okay. Carrie, why don't you talk about how the SBA deals, but then I'm going to come back with the federally qualified clinic information.
Thank you, Congressman. Mr. Flores, I would like to encourage you to look into when the applications are open again for the EIDL loan. There are some exceptions on the number of employees in your organization. The standard size may be different. If you would like to contact me directly so we can take a look at those, I'd be happy to do that with you. You can reach me at my email, which is Carrie, Carrie, period. My last name's ELLINWOOD @sba.gov. And I could talk with you offline. There have been some of the affiliation rules relaxed during these EIDL loan applications, and our Congress is working very hard to get some more funds for small business. And as soon as those become appropriated and available to us, we will be able to reopen that application process. So please contact me and we can work through that piece of it for you. Thank you.
There's also a program for larger businesses, and that's on the Treasury website. You can access our website for information. And Ben, I think you've been in touch with my office before, and you know how to get in touch with us, and perhaps we can run it down. With regard to the reason I asked if you were a clinic is that this is part of the debate going on right now in Washington. We want very much to make sure that this next piece of legislation provides direct support for the medical systems. Large hospitals who are no longer doing anything but COVID-19 issues, they're losing revenue and they need support. Small clinics, doctors, and so forth have seen a dramatic change in the flow of patients and the revenue that comes with them. And so we want to make sure that we keep the medical system functioning by supporting it directly. We'll know, follow this closely. You'll know by early next week, maybe even tomorrow, whether we are successful in providing money now for the healthcare system itself. Also for, as I said earlier, for small businesses and the like. One of the problems that we know we're going to face is the education system. There was an earlier question about that associated with vaccinations. There's no doubt that the revenues for schools across the nation is going to plummet, as it is for counties. Can the state of California make up for it? I think they can to some extent. Again, the reason we want to put money into local governments, among those governments are schools. And we may very well have a very serious problem in the funding of schools as the revenues for schools across the nation and in California declines because of the economic decline. One set of questions that we have not had discussed today is the unemployment insurance. I would urge anybody on this call, if you're an independent single solar business, and as in sol or solar for that matter, take a look at the unemployment insurance program. The EDD, California Employment Development Department, changed its office hours. They're now open, I believe, 12 hours a day. So you can go online. It is, whatever your circumstances, it's a good place to stop and find out what might be available to you there. Heather, can you quickly handle that EDD piece?
Sure. And then the pandemic unemployment assistance that allows the sole proprietors they will start taking applications online on April 28th. So that will be open on April 28th, and whatever date that you identify as when you first became unemployed, essentially, that's when the funding for that sole proprietor unemployment benefits will start. So that is in place now. The additional $600 under the federal, the additional piece to it is also in place as well at the state, and they've been doing a lot of work. They repurposed about 1,300 people in order to be able to address some of the backlog for unemployment insurance. And we do have we do have a resource on our website that outlines all of the frequently asked questions, and EDD has good frequently asked questions and YouTube videos on how to apply as well.
I want to give a big shout out and a big thank you to Dr. Liu, Dr. Carrie Ellenward, and Heather Henry. Thank you so very much. You're wonderful experts. If you don't mind, I'm going to come back and ask you to help me once again. We'll probably do these telephone town halls once a week, or at least once every 2 weeks. Going forward, Eric, I want you to wrap us up by telling us how people can get information from my office. And for all of you out there, be healthy, be social distancing, wear your mask, wash your hands, take care of each other, but not too closely. Thank you so very much for participating. Eric, please wrap it up.
Thank you, sir. You can go to garamendi.house.gov, the Congressman's website, for a list of resources that are available to you throughout the global pandemic. You can also look at the Congressman's social media accounts. All are at Rep. Garamendi to find a list of resources there as well. Additionally, you can sign up for our newsletter, which is available on the website, or you can opt into by pressing *6 on your phone now. Finally, if we were unable to get to your question tonight, please wait. Upon termination of this call, you will be able to leave a voicemail for the Congressman, and a member of our staff will follow up with you. Thank you so much, and have a wonderful evening.
Thank you. Bye-bye.
Thank you.